Okay, so welcome everybody to this week's call. My name is Jackie Boyle, and I always have the honour of being able to host this call on behalf of Dr. Joseph Ahrens. And firstly, I want to thank each and every one of you for showing up today, because without you, it would be a very lonely call. And for those that watch this afterwards, thank you also. A little bit of housework that I'd like to say to you is this call is being recorded, so please do not record this call. We're trying to stay compliant, and we are not aiming to heal, cure or mitigate anything with what is being discussed here today. It is merely just Dr. Joseph Ahrens' personal opinion on the information he shares. So today's topic is about predominantly looking at eczema, rosacea and psoriasis and skin conditions. And we're going to welcome you to ask a few calls through the chat so that we can keep things compliant, and we'll get moving. So first and foremost, Dr. Ahrens, how are you?
I'm really good. As you can see, I'm still here in the Bahamas. Took this picture this morning, and I love to say every day somebody's got to live here, and I'm willing to do it.
Yes, well, I think in Australia, here in where I live, I'm about 20 minutes south of Sydney, and people that live in Sydney always say there are two types of people in Sydney: those that live on the North Shore and those that wish that they did. So it's a little bit like that, isn't it? We all love where we live.
Yeah.
And we always say that we live in God's country where we are, and Dr. Ahrens has been where my husband and I live, and you come down this beautiful escarpment, and it really is God's country. It's amazing. So I'm going to hand it over to you, Dr. Ahrens, and please share with us your wealth of knowledge.
Well, thank you very much. And yes, where your area is absolutely outstanding. And you know, I wish everybody got a chance to live where they want to live. Some people are where they don't want to be. One person's poison is another person's medicine. There's a lot of people couldn't live here because we don't have any facilities. We have very few stores. It is challenging, but I also understand people that are living in big cities. They want to live there. That is just fine. I just do wish everybody could find a place they do want to reside and habitate and be joyful there. But you know what? You can do a lot no matter where you are. I've pointed out several times, if you have a place like this to walk on the beach, that is great. It's motivational. But you know, I've lived in an apartment in New York City before in part of my life. And hey, I just had to make my routine. I had to get up off the couch and 20 feet, do a little loop every hour and just keep myself moving and flexible. And we have talked about that in the past, and we'll talk about that in the future. But today we are still talking about skin. And I want to remind people that there are several layers of skin, the three major layers, and then there's also within those layers several layers, from 3 to 5 layers. We talked about the outside, the exodermis. Exo means outside, exodermis, dermis means skin. And now we're down into the second layer and talking about things that affect our health there. The outside layer is actually very, very thin, if you might remember, just a millimeter or so, very thin. You can scrape it off, just bump against something, it scrapes right off. But fortunately, it does grow right back. A lot of the conditions, though, that we have are the middle layer, you know, the middermis. And there are several disorders and diseases that affect all the layers of the skin. But today we're going to talk about things like rosacea. I just want to make sure everybody can pronounce that properly. Rosacea. And we're going to talk about psoriasis. And if we have enough time, we'll get a little further than that. Well, you know what my job is actually is to be your scientist. I can't be your doctor. I mean, that's illegal, actually. I'm not your personal physician, and anything I do say here, as Jackie has pointed out many times, it's not health advice to you personally. I can't do that. But I can be a scientist, and I can interpret the scientific data for you. And preparing for this call, of course, I went back to the scientific literature, my own research, but that was done some years ago, and I want to know what is the latest. And so let's talk about one of the biggest ones right away, psoriasis. Psoriasis starts with a P, but it's psoriasis. What is psoriasis? Well, you just Google it. Somebody that's got psoriasis, they want to know everything about it, and they Google it, and they say, oh, okay, what is the cause of psoriasis? They know the symptoms. What is the cause of psoriasis? And the scientific literature will say, well, we really don't know. Yeah, unfortunately, we really don't know. But everything points to it being a problem with the immune system. And that's really the state of art right now. As far as people that are depending on the scientific literature, we don't know what is the absolute underlying cause, but we do know that it's got something to do with the immune system. Well, I can go a little further than that because I actually have done some of that research. And a scientist or your own doctor, your personal physician, they will, they'll caution any of their statements, because what actually causes things are all the way down into your DNA. But in real life terms, the problem is inflammation and your immune system that is not regulated. Psoriasis is actually an autoimmune response where your body starts chewing itself up and starts producing excessive skin cells. That's how the eruptions happen. You're making too many skin cells on the secondary layer, not the very top, on the secondary layer. And this erupts into blisters and scales, and it causes itching because the nerve fibers that are in there, they get disoriented between the several layers, and your skin is growing and cracking, and it actually rips apart some of these nerves, and your body just says, wow, something's going on. There's something eating me up. It might be a bug. It might be a poison. And that's what the purpose of itching is. Have you ever thought about that? Why do we itch? It's because your body is saying there's a disturbance, and it might be something attacking you like a bug, or it might be some chemical like an oil from a plant. And that's why you reach and scratch yourself to knock that stuff off. It's an automatic response. It's an important response. But that's why psoriasis itches. And the reason it cracks and flicks is because you're producing excessive amounts of skin cells. Remember, they start in the bottom layer and they work themselves up over a matter of a month or two, 6 weeks. And then they get to the top side, the epidermis, and then they flake off. That's the normal process. But in psoriasis, this happens in just 2 to 3 weeks. And your body can't handle it. You're making too much skin. And the reason you're doing that is your body is thinking there's something going on attacking us, so we've got to make more skin. We've got to make more skin. It is absolutely a problem with an unregulated immune system. Unregulated immune system. So we don't actually know down the bottom, the DNA about how this is happening, but we absolutely know it's the immune system. Now, people have complained to me actually, but that I see everything in terms of flavonoids, that, flavonoids are the solution to everything. It's not true. Flavonoids are not the solution to everything, but what the flavonoids do in your body a main thing is they regulate your immune system. And so if you look at what's tied to your immune system, remember, immune is not just viruses and bacteria, but it's also wound healing. And it's also the inflammatory system is part of that. This is all your immune system. So even broken bones and cuts on your skin, it's part of that you have an immune response. And your immune response is trying to get rid of whatever is attacking you and then come back with wound healing and new skin and new tissue and seal off the problems from the environment. Well, again, here we are back to an immune system that is out of control. You start actually making too much skin. Now, psoriasis is not just on your outside skin. Psoriasis can actually attack any of the epithelial layer. And epithelial is the skin, the surface that's on top of your skin. It's on your tongue, it's inside your cheeks. It covers every single organ in your body. So you can actually have psoriasis anywhere in your body on that is that outside epithelial layer. It's a very thin layer of single layer of skin throughout your body. Of course, you notice it when it's on the outside. And so we think of it as an exterior skin disorder, but it can be anywhere in your body. So you have an attack on your person, could be anything, any type of trigger. It could be real, or actually it can be perceived. Now that might sound strange, but you actually, I know people, there are people that understand when I say that in some types, anxiety can cause hives. This is how our brain works. We don't quite understand, our brain doesn't quite understand everything that's going on. They see a threat, and then your brain tries to take care of that threat, and sometimes it is confused. And so you can have all types of problems that appear on the outside of your body because of a perceived threat. And anxiety, which is a mental process, can cause external symptoms. So some types of psoriasis can be caused from some emotional disturbance. Now, why that happens to you, it doesn't happen to me, that is all about our own personal genetic makeup. So it's very, what do you mean, Joe? What is that all about? Hey, you know what? I can get a bee sting and it doesn't bother me at all. Someone else can get a bee sting, same type of poison injected into your skin. They can go into allergic reactions. We're all different like that. So there are things that cause psoriasis. Some of them are actually wounds. Some of them are chemical problems to our outside skin. Some are derived mentally. Regardless of what the trigger is, the problem is an overreactive immune system. And flavonoids manage your immune and inflammatory system. So anybody want to call me on that? Say, I'm just making this stuff up. Hey, just go to PubMed, pubmed.gov, pubmed.org. This is the literature repository of all scientific information from agriculture all the way through heart disease, pubmed.org. In the US, it's also listed as pubmed.gov. And just put in there psoriasis and flavonoids. Just put those two words in the search bar. What jumps out at you is we don't quite understand what is the cause of psoriasis, but what we do know is those flavonoids appear, as scientists will say, they'll never say something concrete, appear to regulate the immune system and then prevent those cells, the skin cells, from overproduction in response to that stimulus. I think I've showed many times on this channel and other places, a young lady who had psoriasis, and she took flavonoids, and in 1 week it was gone. She'd taken all types of drugs, and you know the number one drug to regulate your immune system is steroids. And you can't go through life taking steroids. There's so many dangerous side effects. I want to go back to the point that it's all about our diet. You are not getting enough flavonoids. You're not getting enough flavonoids. Therefore, when you do get some of these causative factors, these insults, as we call them to you, a trigger, if your immune system is not regulated, it will over-respond. It will over-respond. And people that have psoriasis, their body makes too many skin cells. They're actually trying to scab themselves up because they think there's a wound there, even when there was no wound. And then their own body starts eating itself. It's because they have it. Your body hasn't solved the problem, and all of this part of the immune system is looking for a bad guy, looking for a poison, and there's none there, and it starts even attacking itself. What happens then? You're under attack. Your body makes more skin cells, and without some type of control, taking steroids to calm your immune system down, or preferably taking flavonoids to regulate your immune system. If you don't do that, it's uncontrollable and actually can lead to lesions that will scar you for life. Scar you for life. So the solution here to me is make sure you have a flavonoid-rich diet, and those persons that are susceptible to psoriasis will have less symptoms. So I actually get a little embarrassed sometimes because I keep saying flavonoids. No, it's not about flavonoids. It's about your immune system, arthritis, psoriasis, bronchitis, and that's also an overreaction to an insult that you might have in your upper respiratory system or into your lungs. Your body is overreacting. Any of those itis means inflammation, which is part of the immune system. You need to have your immune system regulated. And you cannot have a healthy immune system without having enough flavonoids in your diet. I know I'm going very long on this particular topic, but it's laying the groundwork for the ones that will follow, because they're all very, very similar. So you need to take flavonoids, and all of us here probably on this call already know this, but tell everyone you need to have flavonoids. Where do you get flavonoids from? All the dark colored fruits and vegetables. That's what flavonoid means. Flavo does not mean flavor. It sounds like it should be, but no, in the Latin, flavo means color. The colored things is where you get most of your flavonoids. Unfortunately, there aren't as many flavonoids in those fruits and vegetables as there were just 100 years ago or 500 years ago, before we had commercialized agriculture. When we used to eat blueberries 100 years ago, 500 years ago, they were so rich in flavonoids and we got enough. But now there are very few flavonoids, even in these dark colored fruits and vegetables. So I'm telling everyone that comes to me for advice to say, look, eat all you can of the dark fruits and vegetables. And also you need to supplement yourself with flavonoids. And I don't even care where they come from. You can buy stuff called citrus bioflavonoids. You can buy these on Amazon. Just take flavonoids. My own research group came up with a group of flavonoids that we think are the best combination in general for everyone. But take any one you want. It doesn't matter to me. Take some flavonoids. You need flavonoids. But why? Because there's not enough in nature. Number two, the basis of your immune system is based on flavonoids.
So Dr. Ahrens, I want to intervene there very shortly because we're watching the clock, and I want to ask a couple of questions of you when you're ready.
You want to ask them now?
I'd like to, so I can. I've got some question in here about collagen in the skin, and the understanding being that collagen is not easily assimilated. And is it best to take the nutrients which encourage production of collagen in the body? And can you expand on this, please? And can you touch on a good baseline to support even the ectodermis, please?
Well, that's a really good question, because that's the next thing I wanted to cover was collagen and glucosamine. Collagen is the stuff that ligaments are made out of. And they're also 60% of what it makes up your skin, right underneath, right in the second layer. That 60% of that is collagen. So yeah, you want to have a lot of collagen, you have less wrinkles. And also your ligaments, they're made out of collagen. Now, everybody of course needs collagen. It is made up of, I think, around 15 or 20 amino acids. Amino acids are the individual building blocks of protein. The individual building blocks of protein. And you put these amino acids together in a certain way, that turns into muscle fibers. You put these amino acids together in another way, turns into collagen. So your body knows how to do that. The problem is when you don't get enough protein and you don't get enough of those specific amino acids that make up collagen. There is some evidence, even though it's very thin, there's some evidence that by eating collagen or taking collagen supplements, that whole molecule, amino acids that is collagen, can absorb into through your gut into your bloodstream. But it's a big molecule, and whether it really does or not, that's still open for debate. But certainly you eat collagen and it is broken down into amino acids, and those amino acids themselves can absorb into your bloodstream. And then your body decides to take those amino acids and turn it into muscle or turn it into the hair on your head or turn it into collagen. So your body decides that. If you don't have enough of that protein in your diet, if you don't have enough of the amino acids that will eventually turn into collagen, you absolutely can benefit by taking a collagen supplement. Now, it doesn't have to be collagen itself, because collagen is made up of these amino acids. You just need to make sure you have enough of the amino acids from various foods, and they can come from any protein-rich diet, including some things that you wouldn't think, like broccoli. So if you take enough protein, you should have enough of all the amino acids you need for your body to reconstruct collagen. Certainly, therefore, if you do take collagen as a supplement, you will absolutely have all the amino acids you need to make collagen. And there are studies, more than one, that show that supplementing with collagen will improve the collagen underneath your skin, and you have less wrinkles. That's a fact. But those people that it improved, they had a poor collagen diet. You see what I'm saying here? If you have enough collagen rich foods, animal parts, and some seaweeds, or if you have enough protein from different places, plant or animal sources, you will have enough of those amino acids that your body will turn into collagen. But some people, because of their diet, they don't have enough of those amino acids that are in collagen, and they're the ones that show an improvement. Now, the good thing is you can't overdo it with collagen, and there's no side effects. And the main thing you can get out of from that collagen amino acids, things like bone broth, or certain seaweeds for those people that are vegan. So, and how much do you need? Everyone needs at least 15 grams of collagen amino acids a day. 15 grams. So if you're taking a collagen capsule, it's got like 1 gram in it, just throw that in the toilet. You're just wasting your money. You need to have 15 grams. If you think you are deficient in the amino acids that your body needs to make collagen, you need 15 grams a day. So that's one thing I want to tell everybody right here. Don't waste your money on these capsules that have 5 grams of collagen. No, don't do that. Just eat a good, healthy diet, and it means animal parts, bone broth, beef gravy. If you don't want to do that, there absolutely is collagen that's available out of seaweed. You can do that also, but you need 15 grams a day for everyone. And you will see, if you are collagen deficient, you will absolutely see lessening of wrinkles, because that is 60% of the structure of your skin. I want to go to the step that's tied to that, and that's glucosamine. Now, glucosamine is not in the tendons, but it's actually where the tendon ties to the joint. And a lot of people take glucosamine because they have like arthritis and they got bone on bone and they're trying to get that layer of collagen in there to stop, which is a lubricant. It's like a rubber, natural rubber against your joints. And so they take glucosamine, and it is essential to build that area between your joints, glucosamine. All right, so Dr. Joe, what does bioflavonoids have to do with this? It so happens that flavonoids help with the synthesis of that glucosamine. It helps your body take the amino acids from these proteins and build that structure between your bone. The third part of that is elastin. You've heard me mention elastin several times, and that's kind of the rubber glue right underneath the outer layer of your skin. So you've got the basis of your skin is collagen, and then on top of that is elastin that kind of holds everything together. And as we get older, our bodies don't make as much elastin. And there is a enzyme in our body called elastinase. It's elastinase, which destroys elastin. And it's a part of everyone's metabolism is to make new elastin and get rid of old elastin. And the way we get rid of old elastin is by this enzyme called elastinase. It breaks down elastin. So that's what your body wants to do, is constantly build new elastin, break down the old worn out elastin, if you will. But the problem is, as we get older, there's more elastinase and less of the production of new elastin. Well, Dr. Joe, what does flavonoids have to do that? Flavonoids inhibit elastinase. Flavonoids inhibit elastinase. So that process of the breakdown is slowed down by flavonoids. So flavonoids stimulate the production of glucosamine and collagen and inhibit the elastinase, which is the breakdown of elastin. And so therefore, absolutely, as you get older, you wrinkle more. Plus, as we talked about a couple of weeks ago, the UV damage comes in there. That also tears up elastin. And flavonoids help prevent the damage from UV light. So it does seem that flavonoids are key for everything. But no, they're back to the immune system. And when I talk about it inhibits elastinase, that is part of your wound healing. You get cut, you got to put everything back together properly. Your body uses flavonoids to regulate that wound healing. And as we get older, unfortunately, we don't have good diets. Everyone knows that. We get older. We've had bad diets our whole life. It finally catches up with us. That's really what's going on here. Flavonoids are there to help that wound healing process. And part of that is to slow down that elastinase, which is the destroyer. And when you get cut, you want a builder, not a destroyer. So we are getting along on time here. Those were tonight the three things I did want to cover. I did want to cover psoriasis. I did want to talk about collagen, and I wanted to talk about glucosamine, and we'll talk about all the rest of the issues. Eczema. I think maybe if we have just a minute, I can talk about eczema, or eczema, as some people say. If you look into the scientific literature, again, they will say, well, we don't know exactly what's caused this. It's flushing in the skin. It could even include some pus-filled pustules. The capillaries dilate. We don't know exact cause, but it looks like it's tied to the immune system. Surprise, surprise. And there's absolute studies as recently as 2019 that showed that things like quercetin help prevent the symptoms associated with eczema or eczema. And so it's all back to the immune system. It's all back to regulating the immune system. And that brings us right back to flavonoids. So how about that?
Okay, well, I wasn't sure if I should have intervened or not, but that was really very, very beneficial. And there's a lot of chatter going on in here in regards to what you have answered there, that it's been really beneficial for Tiki, who asked, because she's been dealing with ligament damages. So even what you were talking about has been really helpful, Dr. Ahrens. So what I have taken from this, if I try and condense it down a little bit, is that we aren't always talking about flavonoids, and it's not here for that particular reason, but it is about knowledge, and it is about sharing knowledge that we can take away and hopefully be able to support people. But one thing that I have understood very clearly is that our diet is going to affect our immune system. Our brain is very much linked to everything that happens. It's the engine, besides our heart, obviously, as well, but the brain's response to what we fuel our body, our brain's response to our environmental areas, our brain's response to our emotional status, our stress levels, all can have an impact on what our skin presents as. So it is really important to look after how we fuel our body, to be able to manage those symptoms of our skin conditions. And what you've been talking about, Dr. Ahrens, is that a reasonable overview?
Yeah, that is. It's all about, again, the immune system. Everything we see on our skin, of course, we're interested in wrinkles and the color of our skin. But actually, our skin, remember, is the frontline warrior. And so your body's doing everything it can to keep it healthy. And unfortunately, it does not get a lot of times the tools that it needs. And it overreacts sometimes because it doesn't not quite clear understand what is going on or not. It overreacts, and therefore you have to have your immune system regulated so it doesn't overreact. This is why I'm bringing up flavonoids in this. And it just always appears that flavonoids are a miracle. They're not a miracle. We could be talking 200 years ago about vitamin C. Well, that was thought to be an extreme miracle, and many people said it was the end all of everything. Just have enough vitamin C. And certainly vitamin C is tremendously important to support your immune system. Now we're learning that it's not just vitamin C, but it's also things like flavonoids. They have to be there also to help support your immune system. Once you boil this down, you see that flavonoids are not a miracle. They're just doing a basic job of supporting your immune system. And it's your wonderful, fantastic body that therefore takes care of all these issues. Good diet.
So, Dr. Ahrens, what I want to say to you also, and I think that maybe others may agree with it too, what you're bringing to the table today and other weeks, each and other week that we come to this platform, is that you're creating an awareness. You're creating an awareness, you're sharing knowledge, and what we choose to take away from this, the gold mine in this is that we have this information that we can share with others. It may not be affecting us now, or it may not be even, something that's relevant to us in our circle of friends and family. But the beauty of this is that it creates an awareness. It's an education platform of knowledge that we can add to our library. I like to think of it as being a book each week that you're providing to us that we can add to our library of knowledge that we can then go and share. So is there anything that you want to finish up on today so we can keep this to the timeline that we promised people we would?
Well, I just want to be sure that people know that we're also trying to bring real information like that instead of just theoretical stuff like the collagen. You need 15 grams a day. And if you're taking a capsule supplement, it's 1 or 2 grams, just throw it in the toilet. It's not worth your money. If you think you are deficient in collagen, you need 15 grams a day. So that's what you should be taking. Things like that, I think, are real concrete information we can bring people.
And of course, I just want to say, because most of us are associated with the awareness of supplements and different types of supplements. So anything that we do discuss here is not linked to any particular supplement at all. This is just an overview. So I do want to actually just put that out there. So anything that you are sharing, Dr. Ahrens, we're not linking that particularly with any supplement that we may be aware of. You're just actually sharing again information for people to take away and use it in the manner that they choose to. Am I correct?
Yes, that's true. Just want everybody to have general information, make their own health decisions.
Okay. So on behalf of that, I want to really thank you, Dr. Ahrens, again for turning up and sharing your knowledge with us. And it is a wealth of knowledge. It always amazes me that I constantly learn from you. I've known you for some of us. Dr. Ron Bosema is the same. I've known you for over 6.5 years now, and I keep learning from you. I'm a student of life. So, and it's interesting as we do age, there's so much that happens in and around us to ourselves, but also to others. But I know I'm darn happy and extremely grateful. I have so much gratitude to think that this information has crossed my path, because my body certainly is a lot happier, and so many others. So I want to thank each and every one of you. Dr. Ahrens, thank you so much. And I hope that all of you have a great weekend. I hope you're recovered from the 4th of July if you were celebrating that. And also, I think it was Canadian Day too. Canada Day, wasn't it? Celebration of Canadian Day as well. So I hope you all got through that and took your extra flavonoids, because red wine actually helps too, I believe. It benefits you. So I'm sure there was a little bit of celebration going on. So thank you so much. And we look forward to seeing you next week. So have a great weekend,
Bye-bye.
everybody. Bye.
Bye.